Hi, my name is Afya Shaikh, and I'm going to present my project called Nuclei Detection with Histopathological Images of Skin Tissue through Machine Learning. So just a little bit about me. My name is Afya, and I'm going to be a junior this fall. I live in Boston, Massachusetts, and I'm president of Helix, which is a STEM-based club. I'm on the executive board of Student Council, and I am the co-communications chair on the Northeastern Regional Student Advisory Council. So I'm interested in anything related to pathology, oncology, dermatology, and computer science, which pretty much sums up my whole project. So for background, skin cancer is one of the most common cancers globally, with over 3.5 million cases diagnosed each year. This means early detection is critical, but in many parts of the world, access to trained pathologists is limited. Even in well-resourced areas, histopathological diagnosis is time-consuming and subjective, which can lead to inconsistent results and delayed treatment. So my project asks a simple but really important question. Can a machine learning model be used to automate the detection of cancerous nuclei in tissue images? And if so, how accurate and impactful could that be? Traditional histopathology requires a human expert to manually examine tissue slides under a microscope for abnormalities, especially changes in nuclei, which are critical markers of cancer. But this method is slow, error-prone, and it's not scalable for low-resource clinics. That's where machine learning comes in. AI tools, especially convolutional neural networks or CNN, have shown huge potential in visual tasks. So I thought, what if we could use that technology to speed up and standardize cancer detection across the globe? So the motivation behind my project is to use machine learning to make skin cancer diagnostics faster, more accurate, and more equitable. So how I built my nuclei detection model, I used a public dataset from Kaggle, which included 30 digitized tissue slides. They were all stained with hematoxylin eosin, which if you look on the diagram, it's this purple-pink stain. So to start, I loaded the dataset and I pre-processed the images by resizing them and dividing them. So this just helps the model focus better and learn. So I used Jupyter Notebook and I coded with Python and I used libraries like TensorFlow and OpenCV. Libraries are kind of like pre-programmed functions that you can just add on so you don't have to write all the code. So I split the dataset 80 and 20 for training and validation, and I used metrics like accuracy, precision, recall, and F1 score to see how well the model is working. So this slide just gives you a basic idea of the behind the scenes of making a machine learning model. So if you can see on the left image, it's completely yellow. So the machine learning model thought the whole thing was just cancer. Not good. So I decided to split my images into quarters, which would help the model learn better. After that, in the middle image, you can see that it just thought everything was healthy. Still not good, but after running the epochs or cycles more, the far right image is what it started to learn. So it shows these little tiny dots, which is showing you what the machine learning model is finally able to identify a little bit of what and where the cancer might be and what it looks like. So this was really exciting for me to see. And honestly, one of the biggest lessons I learned is that machine learning is rarely perfect right away. You're not going to get 100% accuracy the first time you run your cycles. You just have to build, test, and rebuild. And still, there's always room for improvement. So my results are really encouraging for me. The model achieved an 88% accuracy overall. There was a 95% precision for non-cancerous nuclei, which means it was able to 95% accurately identify healthy tissue cells. And there's a recall of 88% for both cancerous and non-cancerous nuclei. So it performed really well identifying healthy cells, and it was also really good at detecting cancerous ones. So why does this matter? In many hospitals, especially in under-reserved areas, there simply aren't enough trained specialists to examine slides. But this model could help. It processes the tissue images, and honestly, when I did it, it was around 10 minutes when I first did it, and after it was getting quicker and quicker. So this can reduce the burden on pathologists to have to go through so many patients so quickly. And this also improves consistently by minimizing the human error that can happen. And most importantly, it can be used on a local computer system. I did this all on my computer, so this could be a practical solution for both urban hospitals and remote clinics. So just to wrap this up, this project explores how machine learning can revolutionize skin cancer diagnostics, not just in terms of speed or accuracy, but in how healthcare is delivered equitably around the world. Skin cancer doesn't just discriminate by geography, but access to quality diagnostics do. In too many places, patients wait weeks for results. Histopathological diagnosis, it can take up to 3 days to like weeks. And if there's delays and errors in the first diagnosis, it takes even longer. So that means this isn't just a technical problem, it's a global health crisis, and it's really important to address. So by automating nuclei detection in tissue samples, my model can extend diagnostic powers to clinics and communities that lack these specialists. It can also reduce diagnostic delays, it minimizes human error, and it can help healthcare workers with real-time tools. Especially with something like machine learning, it can be a great first look at a diagnosis, and then obviously you can have a specialist look again, but this can make the whole process so much quicker and easier. Global health is all about using science and technology to close gaps in care, improve early detection, and ultimately save lives, the whole point, regardless of where someone lives or what they look like or anything else. And honestly, this project is only the beginning. Imagine a future where every clinic has access to AI-powered tools. That's the future I believe in, and that's the future this project moves us closer to. So just references and acknowledgements, I'd like to thank Kohia for the opportunity to present this work, and a huge thank to my mentors for the guidance and support and the open source platforms that made this project possible. And thank you for all your time and attention. Thank you for listening. And if you would like my contact or anything else, this is my final slide. Thank you.